of a positive pregnancy test can be very exciting for all women. But in some women, it may not last long because of the dreadful symptoms that are experienced in the first 3 months of the pregnancy. What are these symptoms that I'm talking about? Most women experience morning sickness, that is vomitings immediately after waking up in the morning, or nausea, the sensation of vomiting, smell sensitivities which trigger this nausea and vomiting. Why do these happen? Now, as you know, when there is a pregnancy developing, an embryo is forming, there is a hormone known as progesterone which is being produced in the body in high quantities. This helps your pregnancy grow, but it does have certain side effects on you. Now, because of this progesterone hormone, symptoms like nausea and vomiting are very high. Smells that you've been used to for the past 20 years suddenly start feeling different, and tastes that you've been liking for 20 years suddenly start feeling different, and this can be attributed to this hormone progesterone. Now, progesterone also has certain side effects like joint pains, low moods, lack of the ability to socialize, feeling like lying down all the time, constipation, and loss of appetite. Sensation of bloating and breast tenderness is also seen because of this progesterone hormone. Now, what can you do to tackle these symptoms? Now, to avoid nausea, preferably avoid the smells that are triggering nausea. And there is no compulsion that you have to eat a certain amount of food only or in certain quantities that you have to eat. Just make sure that you eat small, frequent meals. Excepting for papaya and pineapple, everything else can be taken in pregnancy, but make sure you are able to tolerate what you're taking. Take them in the right quantities, that is, even small quantities is okay, but make sure you take something every 2 hours. It can be a fruit, it can be a fistful of nuts. Making sure you're hydrated is also very important. Now, like all taste, water can also taste different and you may not be able to tolerate it. It can trigger nausea. So what are the alternatives to it? You can switch over to lemon juice, coconut water, buttermilk, or the simple ORS powder. The WHO prescribed ORS powder can be mixed into a bottle of water and refrigerated, and you can replace this with your regular water. Now, if you're somebody who's not exercised all through your life, you need not start exercise right away as soon as you find pregnancy because you may not tolerate it. Ideally, antenatal exercises are advised after 12 to 16 weeks of pregnancy, and that is to be advised by your obstetrician after making sure that you're not a high-risk pregnancy. If you're somebody who's already has an exercise routine, you can continue exercise as long as you're tolerating, but again after getting clearance from your obstetrician. Now, the other things about feeling low moods, yes, it is very common in pregnancy. But if you think you're not able to cope up with it, you're not able to get to your day-to-day activities, make sure you reach out to your healthcare professional. Make sure you talk to your partner about your feelings and take the right help when required.